My name is Dr. Jonathan Francis, and I've been an OBGYN for 27 years, 4 years in residency and 23 years in private practice. And during that time, I've delivered almost 8,000 babies. I've made this channel to help educate and empower women regarding healthcare issues that are specific to you. And so if you have a topic or an issue that you would like me to discuss, leave it in the comments below. But today, we are going to talk about what happens during that first prenatal visit. Hi there, and welcome. If you've clicked on this video, chances are you might be pregnant for the very first time, or you're thinking about it, and you're wondering what to expect at your very first prenatal appointment with your OBGYN. First, congratulations. This is an incredibly exciting time, but I know it can also feel overwhelming, maybe even a little intimidating. My goal in this video is to walk you through what exactly happens at that first visit, what kinds of questions we'll ask, what tests you can expect, and how we'll work together throughout your pregnancy. Think of this as a friendly guide from your doctor, so you feel prepared, confident, and reassured. So let's start with a bit of context. The first prenatal visit usually happens somewhere between 6 and 10 weeks of pregnancy. And that's usually after you've had a positive home pregnancy test and you call to schedule with your doctor or midwife. Some offices can see you earlier, especially if you've had fertility treatments, prior pregnancy complications, or any symptoms that make us want to check in sooner. But for most first-time moms, the first visit falls within that early window. The goal of this first appointment is simple. We want to confirm your pregnancy, establish a safe and supportive care plan, get to know you and your medical history, and help you feel confident about what comes next. It's a lot of information, and sometimes it can feel like drinking from a fire hose. But don't worry, we'll take it step by step. So picture this, you've arrived at the office for your first visit. You'll usually check in, fill out some paperwork. Sometimes this can be done online ahead of time. The paperwork is important because it covers your medical history, family history, and any medications or supplements you might be taking. We'll go through all of this together, but it helps to get a head start. You might also notice that the staff will treat this visit like a little longer appointment than usual. That's because there's so much to cover. Expect to spend anywhere from 30 to 45 minutes and sometimes longer. Once you're in the exam room, we'll start with a conversation. I'll ask about your medical history. This includes things like, do you have any chronic health conditions such as high blood pressure, diabetes, thyroid disease, asthma? Have you had any surgeries, especially any gynecological surgeries? Do you have any allergies? What medications or supplements are you taking? What's your mental health history? Have you had depression or anxiety before? Also, we'll talk about your gynecological and obstetric history. Things like when was your last period, or how regular your cycles were, and whether you've been pregnant before. If you have, we'll discuss how those pregnancies went, any miscarriages, complications, or deliveries. If this is your first pregnancy, that's perfectly fine. We'll build the story from here. Then comes family history. Do your parents, siblings, or close relatives have any conditions that could be relevant, like genetic disorders, diabetes, heart disease, or bleeding conditions? We'll ask these questions because some risk in pregnancy can be influenced by family background, and knowing ahead of time helps us support you the best. Next, we'll gently explore your lifestyle. This is never about judgment. It's about safety and support. I'll ask questions such as, do you smoke or use tobacco? Do you drink alcohol or use recreational drugs? What's your diet like? Do you exercise? How much caffeine do you consume? We'll also talk about your job, your living environment, and your support system. Pregnancy is not just a physical experience, it's an emotional, mental, and social one too. All of that matters for your health and your baby's health. After we talk, we'll usually move into the physical exam. And don't worry, it's straightforward and gentle. Here's what we typically include. We'll take your blood pressure, weight, and height. This helps us set a baseline. We'll listen to your heart and lungs. We'll do an abdominal exam, though at this early stage, we may not be able to feel anything yet. And depending on your history, we might do a breast exam or a pelvic exam. But not every patient needs the pelvic exam at the first visit. But if you haven't had a pap smear recently, we may combine it with this appointment. The pelvic exam can feel intimidating, especially if you've never had one before. But I promise we go slowly and explain everything and prioritize your comfort. Sometimes we'll also take vaginal swabs to screen for infections like chlamydia or gonorrhea because they can affect pregnancy if left untreated. One of the most exciting parts of the first visit is the ultrasound. Many offices will do an early ultrasound between 6 and 10 weeks. At this stage, we usually do what's called a transvaginal ultrasound, where a small wand is placed inside the vagina. It gives us the clearest view of the pregnancy in these early weeks. On ultrasound, we can confirm that the pregnancy is located inside the uterus and not in the fallopian tube or somewhere else. We can also measure the size of the baby, called the crown rump length, to get a more accurate due date. And if you're far enough along, we may be able to see the baby's heartbeat, an incredibly emotional and special moment for many parents. Sometimes, if it's very early, we might not see everything yet, and that's okay. We'll repeat the ultrasound in a week or two if needed. Now let's talk about labs. The first prenatal panel is one of the most comprehensive sets of blood work you'll have during pregnancy. And here's what we check: your blood type and Rh factor. This tells us if you're Rh positive or negative. And if you're negative, we'll talk later about the Rh immunoglobulin shot, or called RhoGAM. We'll do a complete blood count, or a CBC. This checks for anemia, infections, and overall health. And then we'll do infectious disease screening. We check for HIV, hepatitis B, syphilis, sometimes hepatitis C, and rubella immunity. We'll get a urine to do a urinalysis to check for kidney function and screen for infections, and screening for sexually transmitted infections if not already done. In some practices, we also check for thyroid function, vitamin D, hemoglobin A1C, depending on your risk factors. And we'll also talk about genetic screening options. This part can feel overwhelming because there are several choices. Things like carrier screening for inherited conditions, or non-invasive prenatal testing called NIP that looks at the baby's chromosomes in a simple blood test. And these tests are optional, but we'll explain the pros and cons so you can make an informed choice. A big part of the first visit is figuring out your due date, and we calculate this based on the first day of your last menstrual period, and then confirm it with the ultrasound. Pregnancy is about 40 weeks long, counted from the first day of that last period. Your due date is an estimate, not an expiration date. Only about 5% of babies are born exactly on their due date, but it gives us a shared target to guide your pregnancy. One of my favorite parts of the first visit is education. We cover a lot, but here are the key things I usually emphasize. Nutrition. Eat a balanced diet with plenty of fruits, vegetables, lean protein, and whole grains. Avoid unpasteurized dairy, deli meats, raw fish, and limit high mercury fish. Prenatal vitamins. Take one daily with at least 400 micrograms of folic acid. Hydration, drink plenty of water. Caffeine, limit to about 200 milligrams a day, which is about 1 12-ounce cup of coffee. And exercise. Moderate activity like walking, swimming, prenatal yoga is generally safe and advised during pregnancy. And avoiding harmful substances, no alcohol, smoking, recreational drugs during pregnancy. We also talk about common symptoms like nausea, fatigue, breast tenderness, and mood swings. These are all normal in early pregnancy, but if symptoms become severe, like extreme vomiting, we'll discuss treatment. At this visit, we'll also tell you about warning signs, things that should prompt you to call our office right away. And these include heavy vaginal bleeding, severe abdominal pain or cramping, fever over 100.4 degrees, severe dizziness or fainting, signs of dehydration if you can't keep fluids down. Knowing what's normal versus what's concerning helps you feel more confident and safe as you go through the first trimester. And before you leave, we'll outline what comes next. Typically, prenatal visits are scheduled every 4 weeks until about 28 weeks, and then every 2 weeks from 28 to 36 weeks, and then every week after 36 weeks until delivery. This can vary depending on your health and whether any complications arise. We'll also schedule future ultrasounds like an anatomy scan around 18 to 20 weeks and talk about vaccinations such as flu, Tdap, and COVID if appropriate. One last thing that I always emphasize at the first prenatal visit is as much an emotional journey as it is a physical one. It's normal to feel excited one minute and nervous the next. Please know that your OB is here not just to monitor your labs and ultrasounds, but also to support your mental well-being. If you ever feel overwhelmed, anxious, or depressed, let your doctor know. There are resources, support groups, and even medications that are safe in pregnancy if needed. So that's the roadmap for your very first pregnancy visit. We'll confirm the pregnancy, review your medical history, do an exam, maybe an ultrasound, order labs, discuss lifestyle and safety, answer your questions, and set up a care plan for going forward. It's a lot, but you're not expected to remember everything all at once. That's why prenatal care is ongoing. We'll revisit these topics, answer new questions, and walk you step by step until you're holding your baby in your arms. If you found this video helpful, please give us a thumbs up and subscribe for more pregnancy and women's health content. And if you're pregnant right now, congratulations! You're starting an incredible journey, and I'm honored to help guide you through it. See you in the next video.